There you go. Okay.
Severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, by Cristina M. Garza and Rebecca Alvarez. What is SARS-CoV-2? It is an enveloped plus strand RNA virus that causes a range of diseases from the common cold to fatal severe acute respiratory syndrome among humans. Coronavirus causes respiratory, gastrointestinal, and neurological diseases. Utilizes angiotensin converting enzyme 2 receptors to infect and unciliated bronchial epithelial cells and type 2 pneumocytes. It may also attach to other organs that have ACE2 receptors. SARS-CoV-2 is the third coronavirus that has caused severe disease in humans to spread globally in the past 2 decades. Where did SARS-CoV-2 start? The SARS-CoV-2 that began in 2019 emerged at the Wuhan live animal market from an interaction between an animal and a human. The first coronavirus that has caused severe disease was severe acute respiratory syndrome, SARS, which was thought to originate in Foshan, China, and resulted in the 2002 and 2003 SARS-CoV pandemic. Signs and symptoms of COVID-19 are fever, tachycardia, cough, chest congestion, chest discomfort, respiratory disease, nausea, vomiting, chest pain, loose stool, muscle pain, headache, and hemoptylitis. Cardiovascular and cerebral vascular disease may also be seen in these patients. Onset of signs and transmission. Infection can be spread by asymptomatic, pre-symptomatic, symptomatic, and carriers. The average time from exposure to symptom onset is 5 days, and 97.5% of people who develop symptoms do so within 11.5 days. Transmission of the virus can happen by respiratory droplets from face-to-face contact and to a lesser degree via contaminated surfaces. Diagnosis for COVID-19 are done by 2 tests that consist of the diagnostic test and the antibody test. Nasopharyngeal swab is the picture shown on the right-hand side where they have to go through the nasal cavity. And another test that they do for the diagnosis of COVID-19 is the throat swab.
For treatment, currently there's only one medication that has been approved to treat COVID-19. However, there is no cure available. Antibiotics are not effective against this viral infection. However, doctors have seen that antivirals, antibodies, anti-inflammatory agents, target immunoglobulin therapies, anticoagulants, and antifibrotics, as well as BAM, have been able to treat or contain the virus. Plasma is another treatment that has been used to treat the virus. Some doctors also prescribe or tell patients to take vitamins E, C, and D, as well as melatonin, zinc, and aspirin for illnesses that are for those who have COVID that is mild. So for hazards, there are natural hazards and occupational hazards. For natural hazards, you can see more of the seasonal, like seasons. So for example, tropical cyclones, floods, heat waves, monsoons, tornadoes, some cases snow. And for occupational hazards, it would be like being at work or at a store. And there are some posters that can show people about this social distancing to keep the 6 feet apart, as well as personal hygiene, making sure people wash their hands while at work or at any type of store. For exposures, there are 4 types of exposures. There is high risk, medium risk, low risk, and no identifiable risk. For high risk, it would be those who have had contact with symptomatic laboratory confirmed case, so that's someone that is positive with COVID, or someone who has traveled from China to the United States or to any country. The medium risk would be someone who had came in close contact with someone who was positive, or being in a household with someone who who is also positive. Another medium risk would be also traveling from China or traveling to a country that has widespread sustained transmission of the COVID-19. And for low risk, it would be being in the same indoor environment, such as classrooms, lobbies, stores, with someone who had tested positive and is not needing any close contact. And then for the non-identifiable risk, it would be interactions with a symptomatic laboratory confirmed case, someone that is positive, but that does not meet any of the high, medium, or low risk categories. For example, by walking outside and you walk past the person and you don't know if they're ever came back positive or negative, as well as being in the same room as them, or at the airport, or anything like that. For vulnerability, there are 5 domains, such as demographics, public health, economy, politics, and environment. So there was a study done that shows the potential association with these 5 domains and COVID-19 mortality within the first 8 months of 2020. The health impact of emergency needs. The virus has caused a challenge to public health, food systems, and the world of work. About 3.3 billion global workforce are at risk of losing their livelihoods. The lockdown has caused people not to receive an income, and no income means no food or money to pay the bills. The entire food system has been affected. Border closures, trade restrictions, and confinement measures have been preventing farms from accessing markets, including for buying inputs and selling their produce, and agriculture workers from harvesting crops, thus disrupting domestic and international food supply chains and reducing access to healthy, safe, and diverse diets. The pandemic has devastated jobs and placed millions of livelihoods at risk. We must rethink the future of our environment and tackle climate change and environmental degradation with ambition and urgency. We can only protect the health, livelihoods, food security, and nutrition of all people and ensure that our new normal is a better one. COVID-19, The Road to Equity and Solidarity, is a peer review written by several researchers who looked into the demographics, environment, and technology and other mega trends. Such as activity, movements, or patterns that fundamentally alter individual, social, and technological behavior structures. Recommendations to improve preparedness. According to the Operational planning guideline, they suggested to improve preparedness by using these 6 topics, which are suppression transmission, reduce exposure, counter misinformation and disinformation, protect the vulnerable and reduce the health and illness, and lastly, accelerate equitable access to new tools, such as vaccines, diagnostics, and therapeutics.